Hello, young ladies and gentlemen. I'm Dr. Joseph Butler, your geriatrician, and today we are going to talk about something that confuses millions of people after the age of 60, even well-educated, thoughtful people. Dementia and Alzheimer's. Are they the same thing? Are they different? And why does understanding this difference matter so much for your future? If you or someone you love has started forgetting things, repeating questions, losing focus, or struggling with daily tasks, it's very natural to worry. Many people quietly ask themselves, is this Alzheimer's? Others hear the word dementia and feel immediate fear. So let me say this clearly, calmly, and with compassion. Dementia and Alzheimer's are not the same thing, but they are related. And knowing the difference can change how early you act, how much control you keep, and how prepared you are moving forward. Today, I'll explain this in plain language, not medical jargon, just as I do with my patients in the clinic. My goal is not to scare you, but to give you clarity, confidence, and a path forward. Let's begin with the most important foundation. Dementia is not a disease. Dementia is a syndrome, a medical term that means a collection of symptoms. These symptoms include problems with memory, thinking, reasoning, language, judgment, and daily functioning. Dementia describes what is happening, not why it is happening. Alzheimer's disease, on the other hand, is a specific disease. It is the most common cause of dementia, accounting for roughly 60 to 70% of cases worldwide. But it is not the only cause. This is where confusion begins. When someone says, "My mother has dementia," that statement is incomplete. It's like saying, "I have a fever." A fever tells us something is wrong, but not what caused it. Alzheimer's is one possible cause of dementia, but there are many others. Now, let's slow this down and make it very clear. If dementia is the umbrella, Alzheimer's is one of the storms underneath it. Other causes of dementia include vascular dementia, Lewy body dementia, frontotemporal dementia, Parkinson's-related dementia, mixed dementia, and even conditions that look like dementia but are reversible when treated. This distinction matters deeply because not all dementias progress the same way, respond the same way, or require the same planning. Now let's talk about Alzheimer's disease specifically, because this is the word that creates the most fear. Alzheimer's disease is a neurodegenerative condition. That means it causes progressive damage to brain cells over time. Under the microscope, Alzheimer is associated with abnormal protein changes in the brain, particularly beta-amyloid plaques and tau tangles, which interfere with how brain cells communicate and survive. Clinically, Alzheimer's usually begins slowly and subtly. The earliest and most common symptom is difficulty forming new memories. This is why people with early Alzheimer's may remember events from decades ago very clearly, but forget something that happened yesterday or even an hour ago. They may repeat questions, misplace items, or forget conversations. Not because they're distracted, but because the brain is no longer storing new information properly. Over time, Alzheimer's can also affect language, orientation, judgment, visual spatial skills, and eventually physical function. It is typically a gradual progression measured in years, not weeks. Now let's compare that to dementia in general. Dementia describes a decline in cognitive ability that is severe enough to interfere with daily life. That includes things like managing medications, paying bills, cooking safely, driving, or following conversations. But dementia does not tell us how fast symptoms will progress, which brain systems are most affected, or what treatments or strategies may help. For example, vascular dementia, the second most common cause, is related to problems with blood flow to the brain, often from strokes or chronic small vessel disease. Its symptoms may appear suddenly or progress in a stepwise fashion. Memory may be less affected early on, while attention, planning, and processing speed are more impaired. Lewy body dementia often includes visual hallucinations, sleep disturbances, movement symptoms, and fluctuating alertness. Frontotemporal dementia may begin with personality changes, poor judgment, impulsivity, or language problems, sometimes with memory relatively preserved early. So when someone says, "It's just dementia," my response as a geriatrician is always, "What kind? And why?" Now let's address a very important question I hear all the time. Dr. Butler, if someone has dementia, does that automatically mean Alzheimer's? The answer is no, and here's why that answer matters. Some causes of dementia are partially reversible or treatable, especially when caught early. Conditions such as vitamin B12 deficiency, thyroid disorders, medication side effects, depression, sleep apnea, hearing loss, dehydration, infections, and metabolic imbalances can all cause cognitive symptoms that mimic dementia. I've seen patients whose memory improved significantly once these issues were identified and treated. That's why early evaluation is so important. Now let's talk about normal aging, because this is where many people get stuck in fear. As we age, the brain does change. Processing speed slows. Multitasking becomes harder. Names may take longer to come to mind. You might walk into a room and forget why you went there, and then remember a few moments later. This is often normal age-related cognitive change, not dementia and not Alzheimer's. The key difference is function. With normal aging, you may forget, but you remember later. You may need reminders, but you can still manage daily life. You remain oriented, independent, and safe. With dementia, forgetting is frequent and progressive. Daily tasks become difficult or unsafe. Others notice changes, not just you. That distinction, does it interfere with daily life? Senator, is one of the most important questions we ask in geriatric medicine. Now, let me speak directly to those of you who are watching and quietly worried. If you're noticing changes in yourself, that does not mean you're weak. It means you're paying attention. And paying attention is the most powerful first step. There is also a concept called mild cognitive impairment, or MCI. This is a stage between normal aging and dementia. People with MCI have measurable cognitive changes, but they can still function independently. Some people with MCI remain stable for years. Some even improve if the cause is addressed. Others may progress to dementia. But the point is this: MCI is not dementia, and it is not Alzheimer's. Yet, this is why early assessment gives us time. Time to plan. Time to adjust lifestyle factors. Time to manage risks. And time to involve family in supportive ways, rather than crisis-driven ways. Now, let ES talk about why seniors should care deeply about knowing the difference between dementia and Alzheimer twice. First, because knowledge reduces fear. Fear thrives in uncertainty. Clarity restores control. Second, because early identification allows for better medical decision-making. Some treatments, lifestyle interventions, and support strategies are far more effective when started early. Third, because planning ahead preserves dignity. When people understand what they are facing, they can make choices about finances, living arrangements, legal matters, and care preferences while they still have full capacity. Fourth, because not all dementias are the same, and assuming Alzheimer EGS without evaluation can lead to missed opportunities for treatment or stabilization. Now, let me share something personal from my years as a geriatrician. The families who suffer the most are not the ones facing dementia. They are the ones facing surprise dementia. When changes are ignored, minimized, or explained away for too long, crises happen. Falls, medication errors, financial exploitation, hospitalizations. But when changes are noticed early and addressed calmly, families adapt. Systems are put in place. Support replaces panic. And that is why I made this video. So let me give you a simple takeaway you can remember. Dementia describes the symptoms. Alzheimer's describes one specific disease that causes dementia. Not all dementia is Alzheimer's, and not all memory loss is dementia. If you or someone you love is experiencing cognitive changes, the next step is not fear. It's evaluation. Talk to a healthcare professional. Ask for cognitive screening. Review medications. Address sleep, mood, hearing, nutrition, and chronic conditions. Bring a trusted family member if possible. You deserve a thorough and respectful assessment. And please remember this: you are not alone in this. Millions of older adults are navigating these questions right now. Seeking clarity is not giving up. It's taking responsibility for your future. If this explanation helped you understand the difference between dementia and Alzheimer's, please give this video a thumbs up so more seniors and families can find it. I'd also love to hear from you in the comments. What is your biggest concern right now? Memory, focus, confusion, or something else? For more trusted, compassionate guidance on aging, brain health, and maintaining independence after 60, be sure to subscribe and turn on notifications. I'm Dr. Joseph Butler. Take care of your mind, protect your independence, and I'll see you again soon.
Join us on Healthcare Seniors.
Be part of our community and watch the next video.